perhaps there is one theme that runs through all of the scenarios that you're about to see, and that is this. When the atmosphere becomes emotionally charged because of an issue, it's often helpful to address the emotion first and the issue second. In other words, instead of trying to, as it were, settle the issue immediately with a statement of fact or a direct response to that issue, it often helps to acknowledge the emotional content of what the patient is saying first. That way, the patient feels appropriately that he or she has been listened to and heard, and that's an important component of support. Then, when you later come to address the issue, you're on the same side, so to speak, as the patient. So let's see how that works in a few examples. To start with, let's look at a situation that makes most of us feel uncomfortable, and that is when the patient cries. Of course, crying is really a symptom of the extent of an emotion. It usually signals distress or pain, but it can, of course, signal anger, and on certain occasions even laughter or happiness. The important thing is to explore it and acknowledge it, not ignore it. And that is where an empathic response is so useful. Have a look at a couple of these examples and see what you think is most helpful. Would you like a Kleenex for a second, Mr. Thompson? There you go. I'll take a moment. Let us both get our breath back, eh? Yes. I think I have to be honest about this, Mrs. Eden. That sadly, after a second bleed, there really isn't a chance. You can't do surgery. I'm extremely sorry. Joan, do you want to? I'm sorry to be telling you this, Mrs. Eden. So there are some basic, practical, helpful hints when it comes to dealing with crying. Always offer a tissue, or ask the patient if she or he has a handkerchief, and if not, get a tissue. Move closer, and if you feel comfortable, and if the patient does also, then you can touch the patient on the hand or arm. Give the patient some time. Use an empathic response, or ask the patient an open-ended question if you're not sure what precipitated the tears. Now, here's another situation that may actually be more common, but it's still quite awkward for most of us and rather uncomfortable. That is, when the patient is feeling angry. In this scenario, the patient is angry. When the patient comes into the room, the doctor has no idea of what started the anger off. During this scenario, you're going to see how each time it's used, an empathic response stops the interview escalating, turning into a shouting match, and how it is possible to use an empathic response instead of a direct factual response to the patient's criticisms. It's not necessarily easy to resist the temptation to try and shout the patient down, but it does pay off in the end. Come in, Mr. Davis.
Why didn't you tell me about this procedure before it took place?
Oh, obviously you're very upset.
Yes, I'm very upset.
Okay. Tell me what procedure you're talking about and what...
The barium enema that you so kindly prescribed for me. Okay. Do you remember that?
Yes, I do. Tell me what happened. It sounds very
It was
bad.
very painful. It was very humiliating. You think I enjoy going into a clinic where there's an x-ray room where I have things shoved up my ass? You think that's pleasant?
I do not, and I hear it was very, very unpleasant for you, obviously. You're obviously really upset. Come and sit down and tell me exactly what happened and how awful it was. Come and sit yourself down.
They take me into this x-ray room in a clinic
Yeah.
and do this procedure without my knowledge that this was going to take place. Why didn't you tell me that this was going to take place?
Well,
I had no idea of the pain that was going to be involved in this procedure. Had I been aware of that, I obviously would have tried to explore other ways of doing this.
yes. Okay, so it hurt a lot.
Absolutely.
And did it...
You have no idea that this procedure causes people pain?
It doesn't usually cause a lot of pain. It's always uncomfortable. But obviously some people have much greater sort of pain and discomfort.
Well, I just might happen to be one of those people, might I?
Of course. did the pain last just while the procedure was happening?
No, it continued for quite
dear.
some time
Okay.
afterwards when the procedure was over, yes.
So this was
I thought they were going to rip my
traumatic
bowels
event.
out.
Yeah, okay. I'm sorry to hear that.
You're sorry to hear that.
Yes, I am, yeah.
Well, I'm sorry you didn't experience it yourself, so you know exactly what I was talking about.
I understand what you're saying. I mean, I guess the standard piece of information that they give you at the radiology department says it's going to be uncomfortable, and it's only occasionally that somebody's bowel, as it were, is so sensitive that it really, really hurts a lot. And there's no way of predicting who is going to have a rotten time of it.
Well, I guess that's why they call it practice, isn't it?
I take your point. I take your point. I think it's now, even though, Mr. Davis, it was a horrible experience, I want to separate that from the result of the Berry-Menner, because the result is important. Now, although it was a nasty experience, I was worried, when I ordered that, I was worried that your symptoms might have been related to something really serious. I was actually worried that you might have had a cancer in the bowel. I think we discussed that briefly. Now, separating the trauma of the experience from the result of the Berry-Menner, I'm really glad to tell you that actually there was no cancer in the bowel. You're clear. There's no problem. What you have are those symptoms. The symptoms are what we call irritable bowel syndrome, and I'll talk more about that in a moment or two. But even though it was
I am glad that the news turned out that way as well. But had I been a little more prepared, this wouldn't be happening at this point in time.
I understand you. I understand you to this extent. If ever we need another procedure, whatever, a Berry-Menner or a gastroscopy or anything in the future, you must remind me, and I'll remind myself, I'll mark it in the chart, I'll give you some pills which you take the night before and on the morning of the procedure, which will make you sort of almost like a mild anesthetic kind of thing. So
that would have been very helpful.
Yeah. I guess if we'd have known, we do now, but if we'd have known then that it was going to cause this amount of trauma, we would have given you those pills.
It's not my way to treat people in your profession this way, but
I understand.
This is not acceptable.
I understand entirely, and I also understand that you don't normally behave like this. You're not normally that cross. And what I thought is something really bad must have happened to make you this
I
cross.
thought it was pretty bad, yes.
Okay. So I'm glad that it was that awful experience led to the results that it did, no cancer.
Well, I'm glad of that as well.
And if anything, any procedure is needed in the future, I'll give you some pills.
Right.
All right, old chap.
Thank you.
So there are a few useful ways of approaching the patient who is angry. Now let's talk about a problem that is more common, but which is still not easy to deal with, and that